My name is Dr. David Benversi, and I'd like to talk to you about the most common causes of TMJ. And basically there's two main things we're looking at when we look at TMJ. There can be either a major trauma or a minor trauma. And a lot of times when we see or we're talking about that major trauma, it can be something as far as an accident resulting in like a whiplash, such as an auto injury. And then we also have a minor trauma where it can just be everyday wear and tear as far as posture, something as far as picking something up wrong and causing that pain to go up into that area. And basically the main thing that we're talking about when we have that TMJ, or that temporal mandibular joint dysfunction, a lot of times the muscles around that joint are not functioning or working quite as well as they could, as well as there's a disc involved with that area, and we also have nerves that go to those areas as well. Now let's talk first about the disc that's in that temporal mandibular joint. A lot of times when our office we'll see patients that disc actually slips out or comes out of place just ever so slightly, and what that can do is cause the clicking and pain that is associated with that TMJ, or that pain in that jaw. The next thing that we see is that the nerves that go to that area of as far as the muscles around that TMJ joint. And a lot of times if the nerve is irritated and not working properly, it'll cause those muscles in that area to be going into a spasm or be tight, and what that again will cause is that joint not to be able to function and move as well as it's supposed to as well. Now, typically when patients come to our office with this type of a problem, they're going to be experiencing pain, they're going to be experiencing a decrease in range of motion in that TMJ joint, and they're also going to be experiencing a muscle tightness or a muscle spasm in that area as well. And as far as what that affects in their life, a lot of times it can affect things throughout the day, such as their ability to work. If you have a job or an occupation where you have to talk and be able to communicate a lot throughout the day, obviously that's going to be a major concern for you, because you're going to be using your jaw and being able to talk and speak with people all day long. And in addition to that, the next thing that would be a concern is your ability to do your activities of daily living. And the main concern that I can think of with that we see with our patients, is their ability to eat and chew their food that they need throughout the day. And lastly, in some cases it actually even causes people to have their ability to sleep decreased as well. And what I mean by that is their ability to fall asleep, stay asleep, and also the quality of the sleep that they're going to be receiving throughout the night as well. So those are the typical things that we see in our office as far as the common causes of TMJ, or temporal mandibular joint disorder. If you're in pain, we'd love to help. Please give our office a call at 618-519-9334.